My name is Leanne. My instructor is Ms. Ulbrich. I'm here for level 4. I'm doing my week 15 med pass on 3 patients: Cindy Wynn, John Brown, and Ned Cole. We're doing the 9 a.m. med pass, and we're going to start now. All right, first up we have Cindy Wynn. Birth date is 2/2/87. She's 33 years old and she has an allergy to codeine. Her diagnosis is a UTI and seizures, and her doctor is teacher. So first up, we have for our 9 a.m. meds, we have the sulfamethazole and trimethoprim Bactrim DS. So let's see what we have here. I have on hand sulfamethazone 800 milligrams and trimethoprim 160. Expiration is 2030, so that's good. Okay, next up we have Protonix 40 milligrams daily, due at 9. Okay, on hand I have pantoprazole 40 milligrams, expiration is 2030. Next up I have the Lexapro 10 milligram, or excuse me, Lexapro 20 milligrams PO daily, due at 9. On hand I have, let's see, 2 10 milligram tablets of the Lexapro, expirations 2030. There's 2 of them there. Next up I have Dilantin phenytoin. That's an anti-seizure medication. 200 milligrams BID, due at 9 a.m. I have on hand phenytoin 200 milligrams, expirations 2030. So for that, I'm going to check the Dilantin level. And that's all I have due for now. I will, she does not have a temperature and she doesn't have any pain right now. So I will be holding this. All right. So I'm going to go ahead and check my Dilantin level and my white blood cells. Dilantin level for her is 8. Dilantin 8. So I'm going to go here and put an 8. So that's within normal range. And then for the Bactrim, I'm going to check white blood cells. It's 18,000. And the temperature is 98.9. All right. So that's for Miss Cindy Wynn. Next up, I have Mr. John Brown. John Brown, room VC lab, age 70, birth date is 3/17/50, allergies to iodine. His doctor is Dr. Resource Lab, and his diagnosis is diabetes, hypertension, CAD, cirrhosis, ascites, portal hypertension, and esophageal varices. Alrighty, so I'm going to pull my meds. For Mr. Brown. So first up, we have propranolol or Inderal 20 milligrams BID, and it's due at 9. On hand, I have propranolol 20 milligrams, expirations 2030. For that, I'm going to check the blood pressure, impulse. His blood pressure this morning was 152/78. Impulse is 82. Next up, I have spironolactone 12.5 milligrams, POBID. I have to do at 9. On hand, I have spironolactone, 25 milligrams, 20/30. So I would give half of a tab of that. And also for the spironolactone, I would check the blood pressure and pulse on that. So we're not going to do the insulin. We're not going to do the protonics. Next up, I have Lasix, furosemide, 40 milligrams BID, due at 9 a.m. On hand, I have the furosemide, 40 milligrams. Expiration is 20/30. Okay. Next up, I have lactulose, 20 milligrams TID, due at 0900. I have on hand lactulose, 20 grams per 30 milliliters. So he'll get the whole thing. Expiration is 20/30. So then I check the ammonia for this one. And then for Lasix, I check the potassium and the blood pressure and pulse. So now I'm going to check my labs. So then for spironolactone, I could check potassium and sodium. 133 for sodium. Potassium is 3.5. Furosemide, I'm going to check potassium. It's 3.5. Blood pressure is 152/78. Pulse is 82. And then the lactulose, I'm going to check the ammonia level, which is 84, which is elevated. So we definitely need to get that. All right. And then next up, I have Mr. Ned Cole. His birth date is 11/6/45. He's a 74-year-old man, allergic to penicillin. He's in room VC lab, and his doctor is Dr. Summer Breeze. Diagnosis is influenza, pneumonia, and a history of diabetes and COPD. All right, so let's see what we're going to give for Mr. Ned Cole. Actose. Let's check blood sugar for that. Let's see what we have here on hand. Okay, on hand I have glidazone, 30 milligrams, 20/30. Okay. Next up, I have gabapentin, 300 milligrams POBID, due at 0900. On hand, I have gabapentin, 300 milligrams, expirations 20/30. Xanax isn't due, so next up I have the Levaquin, levofloxacin, 500 milligrams, POBID, due at 0900. On hand, I have levofloxacin, 500 milligrams, expirations 20/30. Okay. Next up, I have clopidogrel or Plavix. I check platelets on this. For the Levaquin, I check white blood cells and temp. Clopidogrel, 75 milligrams, due at 9 o'clock. On hand, I have clopidogrel, 75 milligrams, expirations 20/30. Next up, I have hydralazine apresyline, 50 milligrams, due at 0900. On hand, I have hydralazine, 50 milligrams, expirations 20/30. For that, I check blood pressure and pulse. Last but not least, I have the digoxin, Lanoxin, 0.25 milligrams, due at 9. On hand, I have digoxin, 0.25 milligrams, expirations 20/30. So for this, I would check dig level and apical pulse. I'm not going to give the Tylenol because he doesn't have a temperature and he's reporting 0 pain. So I'm going to check my labs. Actose first, so I'm going to need a glucose. It's 60, so we're not going to give this. We're going to hold. So I put glucose 60, hold due to low blood sugar, and I circled it because I'm not going to give it. Next up, I need to check white blood cells for the Levaquin, and they're at 19,000, which is elevated. His temperature is 98.9. Next up, I'm going to check the platelet level, which is 255, so that's within normal range. And then the hydralazine, his blood pressure is too low at 88/52. Pulse is 68. Not going to give that because the the blood pressure is too low. Last but not least, I'm going to do the digoxin level, which is 0.9. So I'm going to give that, and his apical pulse is 68. So I've completed my first check on my 3 patients. All right, so back to Miss Cindy Wynn. We're going to do her second check. So we're not going to be doing the Zosyn. It's not due. So we're going to be doing the Bactrim. First and foremost, let's find it. Okay, here it is. I have on hand sulfamethasone 800 milligrams and trimethoprim 160. It's correct. Expiration is 2030 and it's due at 9. Next up, I have the Protonix 40 milligrams. And then on hand, I have the Protonix 40 milligrams. Expiration is 2030. Next up, I have the Lexapro 20 milligrams, due at 9. So I have 2 tablets of the Lexapro, both 10 milligrams each, equaling the 20 that's due. Expiration is 2030. Okay, and then lastly, I have the Dilantin 200 milligrams. Dilantin level is 8. And on hand, I have phenytoin 200 milligrams. Expiration is 2030. So Miss Wynn has completed her second check for her meds. Next up, I have Mr. John Brown. John Brown. John Brown, room VC lab. Date of birth 3/17/50 and allergies to iodine, and the doctor is Dr. Resource Lab. Okay, first up, I have the propanolol or Inderol, 20 milligrams BID. Blood pressure is elevated at 152/78 and pulse is 82. On hand, I have propanolol 20 milligrams. Expiration is 2030. Next up, I have spironolactone 12.5 milligrams. We're going to check potassium and sodium on that, and also blood pressure, which is 152/78. Okay, on hand, I have spironolactone, aldactone, 25 milligrams, expiration is 2030. So I'm only going to give half of a tab. So I break the tab in half. We're not doing insulin. We're not doing Protonix. Next up is the furosemide. Potassium is 3.5, which is borderline, but he is getting a supplement, so we're going to go ahead and give it. Blood pressure is elevated, 152/78. And then on hand, I have furosemide, 40 milligrams, expiration 2030. Last but not least, I have lactulose, 20 grams PO BID. His ammonia level is elevated at 84. And on hand, I have the lactulose, 20 milligrams per 30 ml. So we're going to give that as well. So I've completed my check for Mr. Brown. Last but not least, I have Mr. Ned Cole. We're going to do our second check for him. Ned Cole is, excuse me, allergic to penicillin. Birth date is 11/6/45. So then the Actos we're not going to give because his blood sugar is too low. So here's that. Next up we have gabapentin, 300 milligrams POBID, due at 9. On hand I have gabapentin, 300 milligrams, expirations 2030. We're not doing this annex because it's not time. Next up I have the Levaquin, levofloxacin, 500 milligrams PO daily, white blood cells elevated at 19,000, temp is 98.9 and it's due at 9. On hand I have levofloxacin, 500 milligrams, expiration is 2030. Next up, I have clopidogrel or Plavix, 75 milligrams, PO daily. Platelets are 255 and it's due at 9. On hand, I have clopidogrel, 75 milligrams, expiration is 2030. Next up, I have hydralazine or apresilene, 50 milligrams. I'm going to hold this because his blood pressure is too low, 88/52, so we will not be giving that at this time. Next up, I have digoxin lanoxin, 0.25 milligrams PO daily. His dig level is 0.9. Apical pulse is 68 and it's due at 9. On hand, I have digoxin, 0.25 milligrams. Expiration is 2030. Alrighty. So next, we're going to go to the patient's room. And we are going to start with Miss Cindy Wynn. Okay, so right patient, right room, Miss Cindy Wynn, room VC lab. Okay, knock, knock, knock. Do hand hygiene, washed my hands, put on my gloves. Hi, my name's Leanne. I'll be your nurse today. Can I get your name and date of birth, please? I'm checking my MAR to her wristband. Cindy Wynn, birth date is 2/2/87. Okay, do you have any allergies to codeine? Okay. Well, I'm just here to give you your medications. So now I'm going to do my third check. All right, first up we have the Bactrim DS. We're going to give 800 milligrams and 160 at due at 9. On hand, I have the sulfamethasone, 800 milligrams, and the trimethoprim, 160 milligrams. Expiration is 2030. So I have your antibiotic here, and that's to help with your urinary tract infection, okay? Next up, I have your Protonix, which is going to help with the gastric acid. It's going to slow down that and prevent your heartburn and stuff. So I have Protonix 40 milligrams due at 9. On hand, I have the pantoprazole 40 milligrams. Expiration is 2030. Next up, I have your antidepressant, your Lexapro 20 milligrams. On hand, I have 2 10 milligram tablets. Expiration is 2030. Last but not least, I have your Dilantin. That's for your seizures, 200 milligrams due at 9. On hand, I have the phenytoin, 200 milligrams. Expiration is 2030. Do you have any questions for me before we get your pills? Okay. All right. Here's your pills. Okay. Swallow. Feeling okay? Okay, well, here's your call bell. Let me know if you need anything. So I've taken off my gloves, washed my hands. I'm going to step out of the room and document what meds I gave. So I gave the Bactrim DS. I gave the Protonix. I gave the Lexapro. I gave the Dilantin. Okay. So Miss Cindy Wynn is complete. next up, I have Mr. John Brown. Alrighty, so I've already completed my second check with him. Okay, so I'm going to check my correct room. Yes, correct room, correct patient. Knock, knock, knock. Hi, I'm Leanne. I'll be your nurse today. Wash my hands. Put on my gloves. Can I get your name and date of birth, please? I'm checking the wristband. We have Mr. John Brown. Birth date is 3/17/50 and allergies to iodine. Like I said, I'm here today to give you your meds. So I'm going to do my third check at the bedside. All right, first up I have propranolol Inderal 20 milligrams BID. I check blood pressure 152/78 and pulse is 82, due at 9. On hand I have propranolol 20 milligrams, expiration is 2030. Next up I have spironolactone aldactone 12.5 milligrams. Potassium's 3.5, sodium's 133, blood pressure 152/28, due at 9. Spironolactone aldactone I have on hand is 25 milligrams. So I'm going to break this tablet in half and only give half of a tablet of that. So there's my half tablet. We're not doing insulin. We're not doing protonics. Next up we have the Lasix furosemide 40 milligrams. Potassium's 3.5. Blood pressure is 152/78. Pulse is 82 and it's due at 9. On hand I have furosemide 40 milligrams. Expiration's 2030. Last but not least, I have the lactulose 20 milligrams POTID for the elevated ammonia, due at 9. Okay, and on hand I have lactulose 20 grams per 3 ml. Okay, Mr. Brown, I have your blood pressure medications and the medicine to help you get the extra fluid off, and then also the medication that you're going to drink, and that's to get the to lower your ammonia levels. Do you have any questions? Like I said, half of a tablet. Okay. Okay, here's your pills. And swallow. Do you have any questions? Here's your call bell. So I'm going to take off my gloves, wash my hands, step outside to chart. So I gave the propranolol, I gave the spironolactone, I gave furosemide, and I gave the lactulose. Okay, and I've completed Mr. Brown. And last but not least, I have Mr. Ned Cole. All right, Mr. Ned Cole. Right patient, right room. Knock, knock, knock. Hand hygiene, put on my gloves. Hi, my name's Leanne. I'll be your nurse today. Can I get your name and date of birth, please? I'm comparing my MAR to my wristband. I have Mr. Ned Cole. Birth date is 11/6/45. An allergy to penicillin. All right. So I'm just here to give you your 9 o'clock meds. Do you have any questions for me? Okay. So first up, we have your gabapentin, which is going to help with the neuropathy pain. 300 milligrams POBID, due at 9. On hand, I have gabapentin, 300 milligrams. Expiration is 2030. Next up, I have the levofloxacin or Levaquin, 500 milligrams, 19,000 white blood cells. Temp is 98.9 and it's due at 9 a.m. So I have your antibiotic also, and that's to help with the pneumonia that you have. On hand, I have levofloxacin, 500 milligrams. Expiration is 2030. Next up, I have clopidogrel Plavix, 75 milligrams, platelets 255, due at 9 o'clock. Okay, so I have the clopidogrel, 75 milligrams, expiration is 2030. We're holding the hydralazine, and next up I have the digoxin, 0.25 milligrams, dig level 0.9, apical pulse 68, due at 9. On hand I have dig 0.25 milligrams, expiration is 2030. So altogether for you today, Mr. Ned, I have gabapentin, which is the neuropathy medication. I have the levofloxacin, which is the antibiotic. I have your Plavix, which is your anticoagulant, and your digoxin, which is going to help your heart. You have any questions for me? No? Okay. Here's your pills. Here's some water. Doing okay? Okay. Here's your call bell. I'm going to take off my gloves, wash my hands. I'm going to step back to the hallway, and I'm going to do my charting. So I gave the Neurontin. I gave the levofloxacin. I gave the clopidogrel. And I gave the dig. I'm going to sign my name at the bottom and my initials, and I am done.